Low back pain is not a serious, life-threatening medical condition. Only in a very few rare cases, outside of someone with a history of cancer, is back pain a medical emergency. Now, this is a good thing because even though it can limit us, it also means we can do things to improve it, and it often doesn't need direct medical attention. Most episodes of low back pain improve, and low back pain does not get worse as we age. The standard course of most pain is to last somewhere between 4 and 12 weeks, with a gradual improvement over time in the majority of situations. Now, in the case of persistent pain, it's important to consider these other facts that we're going to discuss. And while we do see back pain increase into middle age in most cases, this is likely more associated with different factors, such as life stresses, progressive inactivity, and other factors that we will discuss in a moment. A negative mindset, fear avoidance behaviour, negative recovery expectations, and poor pain coping behaviours are more strongly associated with persistent pain than is tissue damage. And despite popular belief, scans, x-rays, MRIs do not determine prognosis or the likelihood of future disability or pain, and a scan does not improve the outcomes of low back pain. Graduated exercise and movement in all directions is safe and healthy for the spine. Spine posture during sitting, standing and lifting does not predict pain or its persistence, and bad posture is a really long-standing myth and one we hope to change in time. While people may be sensitive to a certain posture and benefit from altering it, at least temporarily, this is highly individual and variable by many factors. Blaming any posture inherently is not only inappropriate, but we have some literature showing it can actually lead to longer disability and frailty. A weak core does not cause low back pain. Many people are led to believe that back pain is from weakness or instability, but over the last couple of decades we've accumulated high quality research showing that this isn't accurate. And some people with low back pain actually show higher levels of activation of their core muscles. Now, it is beneficial to keep the trunk muscle strong, and it can be helpful to train them for rehab purposes, but back pain is not inherently due to weakness. Spinal movement and loading is safe and builds structural resilience when it's graded, and there are proponents out there that the spine is not meant to move in certain directions, but this is really not the case. Some individuals may have lost capacity in some motions due to disuse or fear, but this can be regained and built progressively. Pain flare-ups are actually more related to changes in activity, stress and mood than structural damage. And contrary to what many have been told, back pain is poorly associated with structural damage. Instead, it has a much higher association with acute changes in activity, high stress periods of time and current mood. And so effective care for the low back pain is actually quite simple. Current evidence supports treatment that's focused on positive mindset, optimizing general health, physical health and movement, as well as addressing factors such as sleep, social activity, general exercise and body weight. From our own clinical perspective, our job is to reduce the sensitivity within the nervous system that might be aiding that protective response.